For Chapter 7, we're going to discuss the concepts of stress and adaptation. So to start, we need to discuss the concept of homeostasis. So homeostasis, by definition, is the purposeful maintenance of a stable internal environment. And within that purposeful maintenance, we have to have different physiological processes that oppose change to that environment. So a lot of the things that we talk about and discuss with adaptation to stress are going to be related to homeostasis and this need to have processes that restore internal environment. So when a body is exposed to some type of either external or internal stressor, these physiological processes kind of kick in to oppose any change that would be brought about by those stressors. So this maintaining of a stable environment requires us to have multiple mechanisms to adapt to these constant stressors that are coming from the environment. So multicellular organisms are able to survive only as long as the composition of that internal environment is compatible with the survival needs of the individual cells within it. So, for example, something like the pH within the body, we have a very small amount of change that we can have of the pH and still be able to maintain processes that don't disrupt the metabolic needs of individual cells. So something like the pH of bodily fluids needs to be maintained within a very narrow range to be able to prevent cells from dying. So we need to have some sort of physiological mechanism to manipulate pH to keep it within that range. When we get to our conversation regarding fluid, electrolytes, and acid base, we're going to talk about all of those physiological mechanisms that are at play to maintain pH. And that's just one example of all of the control systems that are necessary to maintain this constancy of the internal environment. So an organism is an open system. So within an open system, that requires mechanisms that act to maintain the constancy within that internal environment. Steady state conditions require that any tendency toward change automatically meets factors that resist it. Regulating systems determine homeostatic state. The regulating system determining homeostatic state consists of several operating mechanisms acting simultaneously, and homeostasis does not occur by chance. It's the result of organized self-government within that organism. So that's kind of a lot of information. But again, essentially, that homeostatic control requires all of these different physiological mechanisms to occur in response to change. They all have to kind of work together. And their overall purpose is to bring us back into that stable internal environment that has kind of a constancy to it. So the ability of the body to function and maintain homeostasis under these conditions of constant change in both the internal and external environments depends on thousands of physiological control systems that regulate our body functions. Um, and just like any control system, each stress response involves a sensor to detect the change, some sort of integrator to sum all of the incoming data and compare them with normal, and also an effector that tries to reduce the change. So you need some sort of receptor to say, yep, here's a stressful response. You need some sort of integration system that says, okay, here's all the data coming in. This is what I think this is. This is how it's different than normal. And then it has to be able to do something about it, to have some sort of effect on the body itself. So body control systems regulate all of our cellular function. They control all of our life processes, and they work to integrate the functions of all the different organ systems within the body. So many of the control systems within the body work by negative feedback systems. Um, these work kind of like your furnace. So we'll use that sort of as our analogy to explain how a negative feedback system works. Negative feedback systems are very common within the body. Many of the things that we discuss in our next unit, our endocrine unit, are going to work via negative feedback. Okay. So at the start of a negative feedback loop, when a monitored function or monitored value drops below the set point of the system, the feedback mechanism causes the function or value to increase. So if we go back to our furnace analogy, we have a thermostat within our home that has a set point. So maybe our set point is 70 degrees, okay? And our thermostat is monitoring that value. And if that value drops to, say, 68 degrees below that set point, that feedback mechanism wants to work to increase that value. So it causes our furnace to kick in to release more heat to try to raise up that temperature. Then what happens when that function or value is increased above the set point? So back to our furnace analogy, if we hit 70 degrees or go above it, that feedback mechanism will cause it to decrease. So that thermostat will signal our furnace to turn off. We don't need any more heat. So that's a negative feedback situation. So I have an illustration here of a negative feedback loop that happens within the body. So if we start here, what we're seeing is our reaction to increases in glucose within the body. So say we, eat a big meal, right? And so we get this increase in blood glucose. So we've got values that have risen above our normal set point in the body, this increase in blood glucose. And so that increase in blood glucose signals or goes to its sensor within the beta cells of the pancreas. That glucose causes the beta cells of the pancreas to increase the release of insulin and in turn remove glucose from the blood. And so what that results in is this decrease in blood glucose levels. And so now we've dropped back to a kind of normal set point, and then we go back to those glucose sensors in the beta cells. And because we've reached our set point, those sensors say, okay, our blood glucose has reduced, so we're going to also reduce our release of insulin, and potentially work to add some more glucose back into the system. Okay, so that continues through that negative feedback loop to keep our blood glucose levels regulated at a very specific level within the body. Okay, maintaining that constancy of that internal environment. So let's talk further about the concepts of stress and adaptation. And so this is something that we're looking at kind of more and more within health and wellness. So we've had really over the last, many years, this increased focus on health promotion. And with that has come this heightened interest in the role of stress and biobehavioral stress responses and their impact on the development of disease. Okay? So one of the health promotion pieces that is often talked about is overall stress reduction, because what we recognize now is that increased stress can lead to disease if untreated. So stress may contribute directly to the production of disease or the worsening of diseases. Stress may cause the development of behaviors that are maladaptive, like smoking, overeating, and drug abuse. And so again, these are the reasons why we really look at stress and its reduction as a health promotion sort of behavior. So some definitions here when we talk about stress, it's a state manifested by a specific syndrome of the body developed in response to any stimuli that made an intense systemic demand on it. And that's the author of that definition is here, and we'll talk a lot about his work over the next couple slides, and there's a lot about it within your reading that I think you'll find helpful. Adaptation is the ability to respond to challenges of physical or psychological homeostasis and return to a balanced state. So that adaptation piece are the processes that the body goes through to return us to that normal balance. So these are the stages of what has been termed the general adaptation syndrome. So the first stage is this alarm stage. It's a generalized stimulation of both the sympathetic nervous system, and we'll talk more about that, and what's termed the HPA axis. That's the hypothalamic pituitary adrenal axis. So the sympathetic nervous system is one of our main stress response neurological systems, and that HPA axis is closely aligned to the sympathetic nervous system. And through that hypothalamic pituitary adrenal axis is what releases many of the hormones implicated in the stress response. So again, that alarm stage, a generalized stimulation of both the sympathetic nervous system and the HPA axis that results in release of catecholamines and cortisol. So catecholamines are the main neurotransmitter of the sympathetic nervous system, and cortisol is the main stress hormone released by stimulation of that HPA or hypothalamic pituitary adrenal axis. Okay. So in studies on rats, it was determined the response to stressors was a process that enables those rats to resist the experimental challenge by using the function of the system best able to respond to it. So when we get into that alarm stage and there's this generalized stimulation, in the resistance phase, the body selects the most effective and economical channel of defense. So when we are exposed to a stressor, the body then decides what the best way to bring us back into balance is, and that's during that resistance phase. In the exhaustion phase, our resources are depleted. We get to signs of wear and tear. This stage, the exhaustion stage, the hope would be that in this general adaptation stage, we have alarm and resistance and we go back into that relative state of balance. If that isn't able to occur and this stress response persists, that's when we would hit this exhaustion phase, where we get wear and tear and damage and potentially physiological changes related to the stress response. So stressors can be endogenous, which means they arise from inside of the body, or they can be exogenous, meaning they come from outside the body. But generally, stressors are events or environmental agents responsible for initiating that stress response, putting us in that alarm phase of that generalized stress response. Okay. And there are two types of stressors. They can be eustress, which we term good stress, or distress, which we term bad stress. And we'll talk a little bit more about those two pieces. So essentially, not all stressors are really harmful. Some stress can be really looked at as a positive stimuli. It can help you grow intellectually. It can help you grow emotionally. Essentially, all of these challenges, both physical and emotional, that we undergo help us to develop new learning or better responses, or they help us, spur us into action. So there is goodness in stress, and this kind of overall feeling that we need to protect ourselves at all costs from any stress is maladaptive in and of itself. Stress, as long as it's not overwhelming and can be managed, in and of itself can be seen really as adaptive. So when we look at something like eustress or good stress, it's something that stimulates this intellectual and emotional growth. So within the stress response, there are kind of two things that determine really our response to stress. So two determining factors of stress response. One is the properties of the stressor, and the other is the conditioning of the person being stressed. So as far as properties, is the stressor short-lived and adaptive, like we talked about with eustress, or is the stressor prolonged or severe or traumatic in nature? Does the stressor bring joy or bring grief? So if you're looking at stressors, the things like having a new baby and losing a loved one are both things that are considered stressors, but the response to them might be very different. So the property of the stressor really plays into the stress response that we see someone engage in. Stressors tend to produce different responses in different people. Um, so we can have two separate people exposed to the same type of stress, and their response to it could be vastly different. And sometimes within the same person, depending on the timing, right? Like one individual could be exposed to a stressor during one time period, and then during a completely different time period, and their response would be very different. So there is some sort of influence of the adaptive capacity of the person or of the individual that is changing these responses to stress. And that's what we talk about when we talk about conditioning of the person being stressed. We call these conditioning factors. So conditioning factors can be like internal factors like genetic predisposition, age, sex, or they can be external like exposure to environmental agents, different life experiences. There are some dietary implications and some social support implications. And the risk for developing stress-related pathological processes seems to depend on a lot of these sort of factors or conditioning of the person being stressed. So this piece right here, this conditioning of the person, seems to be very important to the overall kind of stress adaptation response. So we're going to talk a little bit more about that piece. But first, let's talk about this concept of what we term allostasis. And the definition of allostasis is the physiologic changes in the neuroendocrine, autonomic, and immune systems that occur in response to either real or perceived challenges to homeostasis. Okay. So that stress response is meant to increase the probability of survival of the organism. It should be able to be turned off when it's needed and or excuse me, turned on when it's needed and turned off when it's not. And that ability to turn it on and off is what should ultimately limit any damage that the stress response could potentially have to vital organs. Okay. So let's talk about some of the different components of that stress response. That stress response is largely controlled through the CNS or through the central nervous system. So things like the cerebral cortex. The cerebral cortex, when stimulated during a stress response, does things like increasing our vigilance, it speeds cognition, it focuses our attention. Things like the limbic system and its impact on stress response is largely related to the emotional components involved in stress. So things like fear or excitement, rage or anger, any of those pieces that come out in the stress response are largely being regulated by that limbic system. The thalamus within the central nervous system functions as the relay center. So it is receiving information and data from different sources, it's sorting through them, and it's distributing those different sensory inputs to where they need to go. The hypothalamus coordinates the responses of both the endocrine and the autonomic nervous systems. And the RAS, or the reticular activating system, modulates things like mental alertness, further modulation of the autonomic nervous system activity, skeletal muscle and tone. So if you look through this diagram, you'll see all of these sort of central nervous system components, as well as some of the overall physiological impact that we see. Again, so things like increased vigilance, things like increased, musculoskeletal tone, things like overall release of some of these stress hormones, activation of some of our autonomic nervous system, and the release and the overall physiological effects. So I think this diagram will be very helpful to show you the different components of the central nervous system and how that controls all of the neurological and endocrine, so neuroendocrine related responses that we see in stress itself. Another important component of this central nervous system control is the locus coeruleus, or the LC. The LC is this densely populated area of the central nervous system, densely populated with neurons. and it produces norepinephrine, which is the catecholamine released during the stress response. It is thought to be the central integrating site for the autonomic nervous system and its response to stressful stimuli. So when we activate the sympathetic nervous system during the stress response, this is what we term that fight or flight response. And it is really our most rapidly responding mechanism. So it responds almost immediately to stressful stimuli. And it's really our most basic. We see this fight or flight response in, most organisms. So it's very like, evolutionary basic response to stressful stimuli. And what we see when we activate that that sympathetic nervous system is things like increased attention and increased arousal. We may see intensification of memories. So this is often why something like a really stressful situation may really imprint itself in the memory. The heart and respiratory rates increase, so our heart rate goes up, our respiratory rate goes up, our hands and feet might become kind of moist or sweaty, our pupils will dilate, and our mouth becomes dry. The activity within our gastrointestinal tract decreases. So it's good to start understanding some of these overall manifestations of the sympathetic nervous system. You guys are going to talk about a lot of them in your pharmacology course, so they'll kind of come up again and again, and they'll come up again and again within this course. But overall, they're really just a rapid response to these stressful situations. So we talked about a lot of the CNS control, or the central nervous system control, but let's talk about how that also impacts the hormones that respond to stress. So going back to the diagram on the previous slide, you could clearly see how some of those central nervous system pieces in turn then activated some of our different endocrine pieces like adrenal glands to exert control. All of these hormone release and a summary of the hormones released during stress and their impact is found within your reading in chapter 7 and table 7.1. So that might be helpful for you in your study, but we'll talk about a few of them here. So one is the corticotropin releasing factor, or CRF. And this hormone has both an important endocrine regulating function of both of the pituitary and adrenal activity, and also is a neurotransmitter involved in autonomic nervous system activity, metabolism, and behavior. So it has dual function both within that endocrine system and within the autonomic nervous system. It can induce the secretion of what we call adrenal corticotropic hormone, or ACTH, from the pituitary, and that hormone in turn stimulates the adrenal glands to synthesize and secrete the glucocorticoid hormones, primarily that stimulation of what we call cortisol. Cortisol is our main stress hormone within the body. And if again you go back to the last slide, you'll see on the left-hand side through that hypothalamic kind of pathway that the end result of that is the release of cortisol, our main stress hormone. And then it talks about some of the things that cortisol does when it's released. We are going to talk about cortisol and its actions extensively in our endocrine unit. So I'll save much of that discussion for that at that point. But again, just really understanding that cortisol is our main stress hormone released when we have a stressful signal. Angiotensin 2 is another hormone that can be released in response to stress. So the release of angiotensin 2 is stimulated by that sympathetic activation, so that fight or flight. And when we release angiotensin 2, we get an increase in what we call vascular tone. So the vasculature, both the veins and the arteries, tend to sort of, when we say increase in vascular tone, they sort of constrict. And the overall effect of that sort of constriction or that increase in vascular tone is to increase the blood pressure within the body. And so when we are responding to stress, oftentimes our blood pressure goes up. And a lot of that has to do with this reaction of the release of angiotensin II. And the other thing that angiotensin II does, in addition to increasing vascular tone, it stimulates the retention of water and sodium. So we're increasing vascular tone, we're kind of clamping down on our veins and arteries, and we're also increasing the amount of water in the system. And so both of those things, again, will act to increase the blood pressure. And so when you think about that, and I'm sure you all know that blood pressure can be, prolonged increases in blood pressure can cause damage to different body systems. And we'll, of course, talk about that in this class. But one issue here is that prolonged release of angiotensin II causes a lot of pathological changes, and a lot of that has to do with this prolonged increase in blood pressure. Growth hormones are another hormone that responds to stress or that is impacted by stress. So during that initial stress response, the release of growth hormone is initially elevated, but then as cortisol is released, the presence of cortisol causes growth hormone levels to then drop. So after that initial increase in growth hormone, cortisol starts to increase, and then growth hormone release starts to drop. And so if we have someone with really prolonged action of cortisol, this can actually inhibit growth. There is thought that there's a connection between stress in children and a term that an overall term we call something like failure to thrive, where they don't grow, they don't feed, those kind of things. And this may be related to that overall impact of cortisol on growth hormone. Increased cortisol levels also decrease the activation of TSH, which is one of our thyroid hormones. TSH is thyroid stimulating hormone. Thyroid hormone and its release increases the metabolic action within the body. And we're going to talk extensively about thyroids in our next endocrine unit. But essentially, this impact of cortisol and its decrease in TSH is meant to slow down metabolism during times of stress in order to conserve energy. So if we're stressed, we need to use that energy for other things. So by shutting down the thyroid, we can slow down the overall metabolic rate of the body to conserve energy. But again, long term, we don't want to keep slowing down someone's metabolism. So this can relate to things like, weight gain or fatigue, different things that we might see in long-term stress because of that thyroid compromise. In reproductive hormones, we have a lot of studies that show that in women, stress and severe trauma can cause things like menstrual irregularities, lack of ovulation, and even absence of menstruation. And in males, stress can induce decreased spermatogenesis, meaning decreased production of sperm. It can cause things like ejaculatory disorders. It can decrease levels of testosterone, and it can lead to infertility. So there appears to be a significant relationship between the stress response and its impact on reproductive hormones, both for females and for males. And the final hormone I have here is something called antidiuretic hormone, ADH. And when ADH is released, it increases both water retention and causes vasoconstriction. So very similar kind of actions that we see there to what we talked about with angiotensin II. So again, thinking about long-term implications of ADH release on things like blood pressure would be warranted here. So now we're going to talk about the impact on the immune system and the immune system response to stress. So one of the major things to understand is that cortisol release, again, our main stress hormone, overall suppresses the immune system. We leverage this a lot in medicine. If we have a patient where we need to purposely suppress the immune system for some reason, we give patients cortisol to suppress that immune function. But neuroendocrine pathways and our immune system pathways seem to share some common signaling pathways. So they can probably exert effects on each other, meaning cortisol and stress impact the immune system, but the immune system probably also impacts our stress response. So hormones and neuropeptides can alter the function of immune cells. And the immune system and its mediators can also modulate some of that neuroendocrine function. So, kind of both. So, we see receptors for a number of central nervous system controlled hormones and neuromediators found directly on lymphocytes, or one of our main cell types within the immune system. So, we see on lymphocytes receptors for things like glucocorticoids or cortisols, insulins, testosterones, different catecholamines, acetylcholine, growth hormone. So this suggests that hormones and neuromediators influence lymphocyte function overall. Okay. The other thing to understand here with the immune system and stress is not only the response of cortisol to suppress the immune system, but we also know that catecholamines, or those neurotransmitters that are released by the sympathetic nervous system, also inhibit immune function. So people who are under an extreme amount of stress, or are under stress, or under stress for long periods of time, tend to also get sick more. They tend to have more illnesses and things related to this reduction in immune response. Okay. So a little bit more about our adaptation to stress. So our body's responses to these physiologic disturbances are really controlled on like moment to moment basis by these mechanisms, and they're intended to limit the application and duration of their action. Meaning that if there's a stressful response and one of our mechanisms for controlling that kicks in, these negative feedback loops are meant to kind of quickly adapt and shut those responses back off, right? So an example of this is what we call the barrel reflex. Barrel reflex. The barrel reflex is a really rapid reflex. So when someone moves from lying down to standing up, our barrel reflex kicks in and says, let's get the heart rate up really quickly. And that helps to maintain our blood pressure when we stand up. But if we didn't have a mechanism to also shut that off, we would have this kind of sustained increase in heart rate, which we don't want either. So we need systems that kick in quickly and that also shut it back off so we don't have these prolonged actions of these stress responses. So these are mechanisms that have evolved for organisms to respond or to modify their environment, habits, or both to achieve a way of life that is best suited to their needs. Okay. So remember, as we talked about stress, the stress response was largely impacted by two things. One was the nature of the stressor that we talked about a little bit, as far as is it a good stress, is it a bad stress, what type of stress is it? But the other one we talked about was the nature of the person being stressed, right? And so that's what we're going to talk about now, is this thing that we term kind of our adaptive capacity. And it's our ability for successful creation of a new balance between a stressor and our ability to deal with it. We largely term these coping mechanisms, and they are the emotional and behavioral responses that we use to manage threats to our physiologic and psychological homeostasis. And so these are things like, how do we perceive or interpret a threat? Do we perceive a threat as a challenge, or as a threat to our bodily autonomy, right? So a lot of that has to do with how the individual perceives. Okay. So the ability of body systems to increase their function, given the need to adapt, is known as the physiologic reserve. Okay. So our ability to adapt based on organ system function is usually much greater than what is needed for normal activity. So some of this physiological reserve, just to give you an example, is something like our oxygen needs. We have far more oxygen circulating and being carried within the body than what we need to sustain just kind of our basic bodily functions day to day. And so that's what we would term something like physiologic reserve. So if someone is stressed, we have this extra and additional oxygen carrying capacity so that we can increase the supply of oxygen during those times of stress. The same can be said for something like the function of our kidney. We can see people's kidney function drop by almost 80% before it starts to really impact the function of the body. And so there's this huge amount of additional physiologic reserve within the mechanisms of the kidney too, beyond what we really need to get through our day-to-day functions. And so again, that's physiologic reserve. Okay. Um, we also see that one of the factors affecting our ability to adapt, in addition to physiologic reserve, is time. So, adaptation to a stressor is most efficient when change occurs gradually. So, the example I would give here is that of bleeding. If we have a patient who's bleeding from their gastrointestinal tract and that's happening very slowly, we adapt pretty well to that. Their H&H starts to drop. They might, feel more fatigued. They might get some elevations in heart rate. You might see some changes, but that person is able to kind of adapt over time to that slow leakage of blood. But if you have someone who has a very sudden, acute, and significant hemorrhage or loss of blood all at one time, that blood loss, because it happens so quickly, just quickly overwhelms any of our system's ability to adapt. And then we see conditions like shock, which we'll talk about in our cardiovascular unit. So adaptation is most efficient when change in the environment happens really slowly. Um, Other things, adaptation capacity is decreased at extremes of age. So the very young and the very old, they have less what we call functional reserve to deal with stress. And a lot of that has to do with their ability to toward physiological adaptation. The very young have underdeveloped systems like underdeveloped cardiovascular and immune systems, underdeveloped kidney systems, so they just don't have the same functional reserve. Same is true for older patients. So we get more chronic disease or reduction in overall function of many of our body systems. We're less able to adapt to stressful situations. Health status also plays a role here. Um, Someone with chronic health conditions, whether they're diseases of the respiratory system or diseases of the cardiovascular system, of the renal system, all of those things again can reduce our physiological adaptation and our functional kind of capacity to adapt to change. Okay. Nutrition also plays a role here. Um, Someone's nutrition and their intake of different macro and micronutrients help to support the different physiological processes that are necessary within the body to make these adaptations to change. So nutrition plays a role. Sleep-wake cycles. So in some people, stress produces sleep disorders. So things like insomnia, sleep pattern disturbances, and in other people, sleep disorders lead to stress. So there's a significant connection between sleep and stress. This concept of hardiness that you kind of see right here, hardiness describes a personality characteristic that includes things like senses of having control over their environment, a sense of purpose in life, and an overall ability to look at stressors as a challenge rather than a threat. So people who have those personality characteristics tend to have higher adaptive capacity to stressful situations. And the final thing I'll mention is this psychosocial factor. And the largest psychosocial factor that has been linked to our adaptive capacity is social support. So people with stronger social support networks, stronger relationship networks, um, these networks seem to have a purpose of serving as like a buffer or a modifier of the physical and psychosocial effects of stress. So social support has direct and positive effects on people's health and their ability to manage stress. Okay. So when someone is exposed to acute stress, so reactions to acute stress are usually primarily associated at first with that action of the autonomic nervous system or that sympathetic stimulation that leads to that fight or flight response. So things like cold, moist skin, pounding headache, and stiff neck that we sometimes see or in our patients with acute stress, a lot of that is linked to that release of sympathetic nervous system activation. And so that neural pathway activation that mediates our arousal, but also that sympathetic nervous system activity. Um, People with limited coping abilities, either because of physical or mental health, any level of acute stress response may be detrimental to them. So people with significant difficulties in coping or not much adaptability, through a lot of those characteristics that we talked about on the last slide, they're going to have limited ability to deal with even acute levels of distress. Okay. And again, the stress response is meant to be acute and self-limited. That activation of the ANS and the HPA axis ideally is controlled by negative feedback mechanisms that shut it off as quickly as it turns it on. But if we can't turn that off, if we have these chronic stress conditions, we start to see pathophysiological changes occurring within the person. So a lot of the physical changes or physical issues that we see are related to the cardiovascular system. We see gastrointestinal effects. We see immune responses, and we see neurological system responses. And we also see a lot of psychological impacts, things like depression, accidents, suicide, alcoholism, drug abuse, and eating disorders are all related to the effects of chronic stress. And so we really work hard to develop new treatment modalities for stress to try to help people avoid some of those negative coping mechanisms that might further cause deteriorations to their health will be really important here. And we also want to help people discover and implement different strategies to help them reduce stress. So just things like purposeful priority setting and problem solving, different methods of stress reduction, whatever might be helpful to an individual to try to reduce that impact of chronic stress on physiological and psychosocial processes.